bakit ka nag-move to UK?
Honestly.
Kailangan mo ng tissue? Meron tissue. What are the challenges yung mga nasa-face mo sa nurse clinic? Not just the nurse-led clinics, but also as a clinical nurse specialist.
This is the thing. If you don't ask, you don't get.
Tama.
Yes, exactly. What's up mga ka-nurse squads? Another day, another nurse. This is Siege Manto, your digital nurse from London.
I'm EJ. I'm a nurse photographer in the UK.
And this is a show created by nurses for nurses. This is the
Nurse Show! Yes, bro. Kumusta?
Okay naman bro, excited ako today kasi we have a very special and beautiful guest.
Yes.
Diba? Kasi bro, may mga different kind of nurses. May mga clinical nurse specialist, may mga digital nurse, may mga madaming kinds of nurse. Ano pa? Oh.
Yeah.
And yung guest natin ngayon, she is a clinical nurse specialist. So, pag-usapan natin kung ano ba yung clinical nurse. Alam mo ba yung clinical nurse specialist?
Alam ko yun, pero I want to know more about them. Kasi napakaraming ano yan, di ba? Iba-ibang field ang clinical nurse specialist.
Kaya specialist kasi may
So,
specialized sila.
Special case sila?
Oo, special sila.
Oo. Sige, pakilala natin, bro.
Yeah, so everyone,
Nurse
our
squad.
audience in the Philippines, in UK or anywhere in the world, please welcome Shelly. Woo!
Shell, welcome to the show.
Thank you so much.
Thank you. Very, touching. Charot.
Ba't ka na-touch?
Special.
That's a special ka.
Special.
Thank you for having me.
course.
Thank you so much.
Thank you. And how was your travel going to our beautiful studio?
Yes. Central line is
Centraling.
Centraling.
Ang init, no?
Definitely.
But better today than
But
compared.
the weather is a bit unpredictable.
Ilang oras yung travel mo, Shell?
Oh, I came from down south.
Down south.
So, medyo an hour and 30. But okay lang din.
Grabe, no? Grabe yung effort.
Dedication.
Dedication ng ating guest. Okay.
Yeah. So,
Yeah.
Shell, we want to know more about clinical nurse specialist. But before that, can we know more about you? Yeah.
Sure, why
so,
not?
Tagasan ka sa Philippines and how long ka na naging nurse?
So from Cebu City.
Woo!
Yeah, Cebuana. And then
Cebu represent.
I know. And then graduated 2013. Wow. So don't calculate my age. Charot. Pero yeah, matagal-tagal na din. And then been a nurse more than 10 years?
10 years.
Oh my gosh, I've never imagined na makasabi ko yan.
12 years na actually.
So yeah, I've been
Round up pa
always...
yung 10 pero 12 na.
But when I came to UK, I've been in neurology for the best part of it. When I qualified, neurology agad-agad. And ang bigat. Neurology is like, I think that's probably the most heavy field in nursing because of moving and handling. The bedside care is really demanding as well. But I learned so much from it. And then from there, worked in private as well. And then from private...
Sa Pilipinas yan siya?
No,
Sa
here.
UK. Pero sa Philippines, anong yung yung field?
Medical surgical. But
Okay.
both public and private hospitals as well. So before I moved to the UK, my last hospital was in the public hospital sa Cebu.
Ay, dun ka.
Yes.
Magaling dun, bro. Kasi you get to meet different cases.
Oo.
Kasi
Parang regional hospital siya.
yes.
And then 1,000...
Provincial hospital.
Provincial hospital.
Parang regional din pala kasi
Oo.
Ano ba? 1,500
Oh,
beds.
pareho tayo. Regional din ako.
Crazy.
Pero ano yun, bro? Malapit din sa inyo yun.
sa city talaga.
Yeah,
Oo.
sa Cebu City talaga
30
siya.
minutes from
So,
Doon kami nag-duty ng students kami.
Okay.
yeah. So,
Doon ka mahasa talaga, no? Sa,
As in, yeah.
The
Doon ko
resources.
nakita na sa ED, patient na naka-intubate, naka-ambubag, pero sino nag-ambubag?
yung bantay.
Hindi.
Yung pasyente.
Siya, pasyente. Ganun siya. Totoo to, promise guys. Nakita ko talaga.
I think the experience there, and if you work there or student nurse ka there, yung resourcefulness mo as a nurse, parang
Ganun.
I think that you'd grow
Normal scenario yun, bro, nag-aambubag talaga yung pasyente. Grabe. Maswerte na yung kung bantay nag-aambubag.
Oo nga.
Bonus na yun.
Kawawa naman.
Kasi ako sa med-surg din ako sa regional. Doon ko na-experience na yung cannula, wala kasi kaming cannula, out of stock.
Kala ko doon ko na-experience yung pasyente siya nag-insert sa
Hindi naman. Pero dahil walang cannula, di ba irereseta sa bantay?
Bibilin pa nila.
Bibilin sa labas. Pagbalik dating doon, isang cannula lang. So, kaya magagaling po ang mga Pilipino mag-cannulate.
Yes! Sharpshooter.
Dapat, ang dala nun yung blue or pink na bili nila.
22 or 20.
Magkano lang yung pera nila, di ba?
Oo.
Isa lang ma-afford nila. So,
dapat
dapat shoot mo talaga. Kasi kung hindi, kawa naman yung
Bilhin mo pa ulit.
Totoo. Yeah, so dun. And then, from UK, neurology agad. Adult nursing.
Before that, bakit ka nag-move to UK? Kailangan ba
Honestly.
Kailangan mo tissue? Meron tissue?
Pera. No, joke lang.
Pera.
Pero, pera, and I think the opportunity as well.
Okay.
Yung nurses kasi sa Pilipinas, no, ang gagaling natin, like, talent-wise, intelligence-wise, magaling.
Okay.
Why would we be exporting our own nurses if hindi tayo magaling, di ba? Pero, lack of, I think, support, growth, and then, wala masyadong nurse leadership that is really, like, inspiring other nurses to also, aspire to become a nurse.
Okay.
I think what we see back home is always like, you become a nurse, you graduate as a nurse, and then you move abroad. Kasi
Parang ganun na yung trend. Pero bakit UK? Nagtingin ka rin ng ibang opportunity.
Yeah, I worked my way to US as well, and then NCLEX, pero hindi tayo pinalad doon. And then magastos. And then at that time, the opportunity for UK was very enticing kasi you only pay for the IELTS, but everything else.
Mabilis, no?
And then the papers were so quick. Lahat mabilis. And then, after IELTS, yun na.
CBT na.
Alis ka na.
Alis ka na.
Parang sa UK, you can fly like within 3 months to 6 months. Unlike US, mag-wait ka pa ng may retrogression.
Parang the fastest way to go abroad kung gustong-gusto mo talaga umalis,
I
UK.
think was UK. UK was the key. And then, yun din yung I think the opportunities na madami, kasi pinupuntahan talaga tayo ng recruitment, diba?
Yeah.
Especially the trust, pumupunta talaga Cebu, Manila.
Cebu yung agency. Kasi may agency.
Omanfil.
Magkano kayo?
Shout out.
Magka-brad, magka-sis.
Tinatanong namin yung mga guest namin ng agency mo. Kasi either Omanfil or ASC.
Yeah.
Yes,
Usually,
may ASC sa Cebu.
Yeah,
din,
meron.
diba?
Pero
ASC Cebu.
I think usually ang AC kasi medyo hindi siya central like mga zone 2, zone 3 na hospitals. Yung central kasi feel ko lang
Omanfil.
Yung Omanfil.
Okay.
Ay, oo.
Sa Manila siguro ASC talaga.
Biggest trust siguro. Pero, depende din.
Depende.
Anyway, so after nun, nag-UK ka na.
Yeah.
Nag-start ka ba sa ward?
Oo, ward.
Yung sabi mo, yung ward.
And then, medyo siya, long-term ward siya. So, hindi siya parang...
So may yung pasyente nyo, mga 2 months doon? Or more
6
than?
months.
Okay.
Yeah,
kilala
so
niyo yung
hindi
mga
siya,
pasyente.
hindi siya like the usual setup na admit discharge.
Mm-hmm.
Na-shock ako like, hanggang kailan to patient dito?
Baka dyan na nakatira. Parang naging na.
Nag-maternity ka na, pagbalik mo, doon pa, no?
Yeah, pero yung set up the rooms and everything, kasi parang I started in a charity hospital, was long-term unit siya, but then in the other bits of the hospital, there was ventilation, may ventilated, my brain injury. So, ang dami, dun ako sa long-term unit. And then, grabe, matatagal.
Ilang years ka doon?
3 years din ako doon.
Tumagal din siya.
Tumagal pa din siya.
Tumagal din. And then, from that hospital, I moved to ventilated unit. So,
Okay. Private, yun yung private.
Hindi, ito pa, doon pa din,
doon pa din.
same hospital. Neuroventilated unit, so mga
yun ba yung naka-mec-vent?
Yes, for long term.
Long term
As
din.
in, like,
Pero hindi siya like, parang,
hindi siya level 2, I think. Hindi ICU
hindi siya ICU
setup.
type, okay.
But, may mga cuff assist pa rin nangyayari, and then all that. But, very stable. But, if they become unstable, diretso move to acute.
Okay.
Ganun siya yung setup.
Ilang years ka doon?
Yun, nagtagal din ng 3 years.
So, total of 6 years ka sa ward, sa bedside?
No, 3 years.
3 years.
And then 2 years sa private.
Okay. So, 5 years in total.
5 years.
And then-
Before you went to, CNS.
Before nag-venture.
Ano yung trigger? Okay, I think kailangan ko nang mag-check ng ibang work.
No, dun pa sa first work ko, yung may mga CNS na dun, may tissue viability nurse kami and infection control na CNS. Both were Pinay. And then pag nagre-round sa ward, amazed ako kasi wow, nagre-rounds yung nurse. Wala ako masyadong nakitang doktor na nagre-rounds.
Correct.
'Di ba? So, sabi ko, I think this is for me.
Something
I
you
think
want
this
to
is
try
what I
or-
want to try
okay.
eventually if I venture out of bedside nursing. So then nag-private hospital ako. Dun medyo tayo dun, like dedicated sa bedside nursing. And I took the opportunity, nag-level 7 na course. Neuroscience course siya na ginawa ko. And then,
Pero
I was
ano ka
just
nun? Nag-band 6 ka nun muna sa NHS?
senior staff.
Senior staff.
Senior
Okay.
staff nurse. And then, yun na, nag-level 7. And then I just was really, nasa track jobs lang ako, NHS jobs, and was just looking for, try ko nga, like, CNS roles, why not?
Diba?
And then, yun. This one that I'm currently in it was a fixed term role na to develop the service. So,
Okay.
malaki-laking responsibility din siya.
Is it band 7 na or?
Band 7. But yeah, I've learned so much from it also.
Kumusta naman yung naging adjustment mo from, yung una muna, NHS ka, di ba? Tapos lumipat ka ng private.
So, hindi siya NHS, but we had NHS-funded patients.
Okay.
So,
Okay.
para siyang charity
Charity hospital,
hospital.
na yung patients nyo is funded by the NHS.
NHS, but we also get some private
Private
patient.
Okay.
fine.
So, yung adjustment mo, di naman ganun kahirap pag
So,
lipat mo.
walang difference sa management or sa patient?
Sa patient
Dynamics.
load, patient dynamics siguro when you go to private, it's much more talaga, like, really, you hear, like, patients first. Like, it's
parang-
patients first. It's always, like, it's more about customer service, I think, sa private. Yun yung difference. And then when I moved to NHS for the CNS role, it's also, there's I think there's like the difference of being private and in NHS is a lot, it has a lot of factors, but if you do it right, it will it can work. Pero yun nga lang, kailangan lang talaga ng pera.
Bilis naman
to
yung
go-
adjustment.
To go private, masyashock ka. Nung nagpa-private ako,
Ito
oh
na ba?
my God, ito ba yung admission natin rate and bed for a private room? But, my gosh.
Grabe, no?
Insane. But, kung nasa Pilipinas pa tayo, like, inaabuso na.
Tama.
natin yung insurance.
Maano mo dito, di ba? Makikita mo, ma-appreciate mo yung
Totoo.
service.
Definitely. And I think it's really rewarding to have NHS as well.
Yes.
Because I think I can't see it. You say United Kingdom without NHS. Parang it's just a reflection of the country as well.
How
And also,
successful. Yeah.
NHS may not be perfect, pero it's trying ba?
Yeah.
Kasi ang dami din kasi naman nating mga patients. So,
Oo.
It gets overwhelmed.
but it's trying, I think. But anyway, talking about clinical nurse specialist, can you tell all of us, kasi madaming curious din.
Curious,
Ano ba talaga yung clinical nurse specialist? What's a typical day for a CNS?
Well,
And anong klaseng clinical nurse specialist ka like? Is it general neuro or is there any specific
yeah,
CNS?
it's very niche, charot.
Oh.
So I'm a myasthenia gravis clinical nurse specialist.
Specialist
Ano yung
for
masaya grabe sa
MG.
yeah.
Ano, pathophysio. But yeah, so it's a neuromuscular disease, very rare disease, and then sadly it has no cure.
Okay.
So once you're diagnosed, you're in it for the long run. But there's really a lot of opportunities now. I think that's why my role was It was a product of a service because there's a lot of pharmaceuticals companies that are already putting out the drugs to
Oo.
not cure it but somewhat really lessen the symptoms and all that. So a typical CNS, I think, in my point of view, is very. You have to be very organized. I always do a job plan, weekly job plan, because a
parang teacher,
Monday,
Parang teacher lang.
Monday,
Planning,
Tuesday.
no?
It's not that you don't have. It's not like the bedside nursing that you have. Like, okay, on a Monday, Tuesday, Wednesday, if that's your 3-day long
Parang
day
papasok
shift,
ka na lang, yun na yun.
you have
Oo.
the patient. Ito yung load mo, and then medicate,
Okay.
document, medicate, out of bed, all that drama and all. This one is you have outpatients. You have to have if you're a CNS in the NHS, parang you have nurse-led clinics. And in the clinics, you can discuss with the patients about treatments, side effects of the current medications they're having, counseling, and then referrals if they need, like community referrals and everything. I think this is where the NHS really gets its job done, because it's not just if you refer them to an acute hospital, there's a community as well where they live that can look after these,
Closer to,
patients.
Yeah.
So that's it. And then on the next day, you just have to have. I have a huge spreadsheet.
Yeah.
I wasn't a master of Excel before I got to be a CNS.
ang galing mo
Ngayon,
And
naman.
ngayon,
na,
parang
master
wow,
na.
may mga sum na ako. And
May mga formula
yes,
na
formula na to help you with the work. But yeah, it's really just about, but I say it myself, organized mess.
Organized.
Ano yan?
Medyo-
Ang
Organized chaos pala.
Yes.
Oh, organized
chaos.
chaos.
No? Chaos, no? Pero at least yung sanay ka na ngayon sa work mo.
Oo.
Band 7 post, di ba?
Band 7 post. Pero luckily, wala akong usually band 7s, they have management.
Okay.
Wala akong management.
Ay,
So
gusto
more
ko
on
yun.
clinical lang ako.
So
for
to
the
our
meantime.
viewers, para may idea sila kung ano yung band 7.
Yeah.
It's like senior
Yeah.
staff
Kasi pagdating
nurse.
mo,
dun
pagkakuha mo ng license mo, start with band 5.
Yes.
And then,
Yeah.
Band
Pag
six
nakuha mo yung license, ako bro, anong dumating ka dito pala? Ano?
Band 3.
Band 3.
Yeah, band 3
Yeah.
din ako.
May iba ngayon, band 4 na.
Ako nung dumating ako dito band 4.
Yeah.
Tapos nung napasa na yung OSCE, band 5 na.
Yeah.
So pag band 5 is like nurse 1. Kung sa
Oo,
Pilipinas, parang nurse
Pilipinas.
1 ka. So pag na-promote ka na, band 6, para ng nurse
Medyo
2.
senior na. Medyo senior na.
Oh,
Senior
ano ka, nag-in-charge ka na sa department,
Yeah.
naghahawak ka ng staff.
Yes.
So, if you want to go higher, band 7,
7.
pag sa amin is, managerial position
yeah,
na.
managerial position
Oh,
na siya.
which katumbas yan ng CNS, which is band 7.
Band
as well.
7.
Either managerial or specialist.
Yeah.
A specialist, yes. Oo.
So, to be honest, I really was lucky to have this role, I think, na walang managerial
Oo.
side.
Oo.
Hindi ka pang manage people.
Hindi
managing
ako
people, no? Actually,
manage.
same. Hindi ko.
Oo.
Parehas tayo.
Nahihirapan ako. I mean, it's not my strength.
Oh.
Charot. Oo.
I cannot see myself as a manager kasi parang mabait ako, bro eh.
Sa bagay, you have to be on the firm.
You have to be firm eh. Parang,
Grabe.
You know, you have
may
to...
ako
where to say no.
ng mga favor niyan.
Yeah.
You need to say
Especially-
no.
Tapos, dito pa sa UK, mahirap din siya. Kasi sa Pilipinas, at least, medyo familiar yung culture. Dito kasi parang iba-ibang lahi. So, you have to, you know them.
Sensitivity
talaga.
and you have to be careful
Yeah.
and hear everyone out. Pero medyo ako dyan. Hindi ako
Hindi
weak
mo forte.
ako.
Oo.
Yeah.
Ako din. Hindi ko din
Oo.
So yun, clinical side ako, but very medyo you'll get pressured from it as well because you have to check blood tests from patients, the results.
So, you take bloods.
I take bloods and then sometimes I also
You're-
ask them to go schedule outpatients or with the GP.
Yeah.
And then, you have to look out for their blood tests and all that. Kasi if they're in a certain treatment or, you have to watch the trend every 3 months, every weekly, if may adjusting
nagpa-follow
of the
up ka talaga,
dose.
no?
Oo, ganun. My gosh. So, medyo, you have to be on top of everything, but at the same time, medyo,
Pero di mo
ngarag
naman
ka
diadala yung mo at home. Di mo siya diadala yung trabaho mo at home.
this is where the difference of having bedside nursing and the CNS role. Kasi madadala ko talaga yung work after 5 p.m. sa bahay.
Parang may assignment.
Oo, kasi may emails ka. Well, the rule should be never check your emails after 5 or before 9. Or if you're on holiday or weekends, never check them. And ako parang medyo
Paranoid ka or...
paranoid ako. And then, I'm improving on it now. Hindi ko na siya, wala nang notifications and all. Pero at the start, in the first year of this role, nag-check ako past 5 p.m. Pero I think I just really wanted to be good with the job.
Oo, syempre.
Oo, pero yun nga. Yun.
Siguro sa una lang.
Especially ngayon kasi 'di ba may anak ka na.
Oh, yes.
Tas ang hirap no parang balancing mom tapos mag-check ka pa ng email instead of you're looking after your
Yeah,
family.
that's true. Now that I've realized when I became a mom, that it's really hard. Really, it's hard for a working mom
Yeah.
in any industry, I think.
Not just nursing.
Not just nursing, but I think mas hands down ako sa mga naka-shift na bedside nurse na may mga anak. Like,
Grabing sacrifice.
Sacrifice and time budgeting.
and childcare.
Childcare. Hindi lang sa mga sa mga mom bro kasi
The
ang alam ko
dad.
yung sa mga dad din. Kasi yung mga ka-work ko bro na na ang liit pa ng baby. Sa train station sila nagpapalitan.
Oo,
Kasi
totoo
yung,
yan.
'di ba, tulog yung bata, kailangan pumasok ng mom. Tapos
Yeah.
yung dad naman pagpauwi ng
parang
night
doon
shift.
sa nakikita.
Doon na makikita. Tapos yung tulog yung baby dadalhin sa train station. Yun yung mga sacrifices ng mga yung mga nag-start pa lang mag-family dito sa UK. Yeah.
Mahirap.
Yeah. Pag-usapan natin about yung family mga challenges mo sa family.
Char.
Punta mo tayo sa parang na-mention mo kanina about nurse-led clinics, no? Ask ko lang, curious lang ako kasi, anong difference ng nurse-led clinic compared to yung may
Consultants.
doctors or consultants consultation?
I think this is where the open communication, tinuturo sa atin yan when nursing school, diba?
Okay,
Like, nurses just approach communication, therapeutic communication differently than, I think, doctors. Because doctors are very much diagnostics and treatment and very like
Straightforward lang yun.
Straightforward, yeah. And to be fair as well for the doctors, the consultation is just like 20 minutes. And they really have a long wait list.
Yeah.
So for the nurse-led clinics, you have to be I make sure that those patients who are in my nurse-led clinics, I ask them, okay, so how was the consultation with this doctor? How did it go? Do you have any questions?
Ano ba yun, like after ng doctor, nurse,
Yeah,
ilang
so
days yung
my clinics usually, so the SOP of my CNS role is they have to be seen by the neurologist first before I see them.
Okay, anong gap? Like how
So
many
medyo
days after?
No, weeks or months.
Oh, really?
Yeah,
Grabe,
depending on the urgency. Usually kasi the consultants, they will email you and say like, can you fit it's not urgent, or sometimes can you fit them in, blah blah blah, so that we can work up the treatment. So you really have the
So is it more of like parang education, yung parang education?
more on counseling, support, and education on the treatment. So they know what their treatments are gonna
Right,
be because the doctors will discuss it with them. Pero medyo kasi yung patients, I don't know, it's
questions.
everywhere. No, kahit sa Pilipinas pa, hindi sila
Tatanong sa
makaka-ask
doktor.
sa
Oh, yeah.
doktor.
Hindi makadiretso, no?
Parang pag nag-rounds, ikaw mag-morning rounds ka na, may problema ka, wala, okay, okay
Diba?
ako, super ganda ng sleep ko, tapos mag-rounds na yung doktor, sabi ng consultant, tapos sabi ng consultant, any problem, tapos, Doc, I have this one. I have this
Lalabas
one."
lahat ng problema, no?
Tinanong kita kanina. Oo, so dun, yung nurse-led clinics ko that's where I discuss the
Okay.
questions and all that.
Yeah.
Side effects, alam niyo ba, was it explained to you? If your consultant made you sign the consent of the treatment, blah, blah, blah. Alam mo
You
ba
have to
tong
check.
risk, benefits, and all that. Just to be sure na they understand it. Because when they're in the treatment, like, sometimes I think it's really just down to the patients as well. Their anxiety.
Kasi, for example, labi na kung ma-diagnose, labi na, bisaya na ako. So, lalo na pag, okay, you're diagnosed with this one. Of course, parang, doon na sila sa
Shadow.
focus sa,
Sa
diagnosed with this, so maybe
Tama.
they cannot retain information na.
Para ma-lessen yung anxiety nga naman nila.
Yeah, so medyo
Marami kasing tanong sa isip nila na ikaw ang
ikaw yung
nurse,
key.
ikaw yung
na,
key.
So ano ba talaga? You keep prying and
So,
asking
it's
them.
important na you also be knowledgeable sa
Yeah, totoo.
Oo.
So I think I
case.
learn on the job every day.
That's good.
Because I always tell my patients, you are the experts kasi kayo yung matagal
Nakaramdam.
na,
Yes.
nakakalandam, the triggers that you have, kayo yung may alam kung kailan to darating, kung anong oras anong oras yung symptoms mo during the day. So you tell me how I can help you. And then if I ask you what you need, para talagang two-way,
Gabi lang dyan, no? Therapeutic communication, bro, no? Yun,
Grabe,
diba?
kailangan ko i-therapeutic communication yung self.
Tell me how you feel.
What are the challenges yung mga na-face mo sa nurse not just the nurse-led clinics, but also as a clinical nurse specialist? Like, for example, yung mahirap yung communication, mga language barrier, mga ganyan.
Yeah, I think the challenges I think is because sometimes I don't mind you being a point of contact of the as a CNS, you become a point of contact for the patient. So kahit anong problema nila, pwede if it's a headache, they can go to the GP for that, but if they go to you, fine. But you just have to remind them na punta kayo sa GP po.
GP.
Pwede po paracetamol dyan or pwede kayo pupunta sa pharmacy and they'll provide you with that. So just a reminder, pero yung challenge talaga is ikaw yung center of the MD, multidisciplinary team.
Yeah.
So you have to work out pharmacy, you have to
Pag
work
MDT, ikaw nagsasalita doon.
Hindi ako quiet lang.
Quiet
pero
lang.
after ikaw yung parang background kasi lahat, oh my God.
Sa'yo.
Lahat. So yun yung challenge. You're doing the ano bang tawag doon? Hospital diplomacy.
Oo.
Sa lahat.
Parang gano'n.
Oo, sa lahat na ng department. So, ikaw yung kataga polish ng lahat so that it will work out perfectly. Hopefully, perfect. Pero medyo, there's room for improvement.
So, anong bro? Gusto mo mag-CNS?
Actually, nag-aral ako kasi ng heart failure course.
Oh,
pero level 6
wow.
lang yun. Pero,
Kahit no. Big time.
there was parang plano ko before na parang meron akong like time na gusto ko mag-nurse, especially mag-heart failure nurse. Pero kasi sa work ko ngayon sa digital nursing, meron kaming heart failure ward. Tapos as time passed by, parang na-realize ko na parang ang gulo, ang nakakapagod. Kasi nag-shadow na ako sa mga heart failure nurse. Parang nakakapagod kasi parang para silang doktor actually.
Yeah,
They
yung questions
can prescribe, they can like
yeah, well,
unless kung may ka.
Totoo. The band 7s though, if you look it up, dapat nurse prescriber na talaga. But there are a lot of CNS na band 7 like me na wala pang
Di pa.
prescriber course. But
Mahirap
you have
daw
to
yun.
work for
Isa sa pinakamahirap
2
na
years
course.
din.
As in.
My gosh.
So yun, parang sabi ko, ayoko na. Tapos bumalik sila sa akin, sabi na, di ba may course ka na kasi sila yung nagbayad ng course ko. Pag ka na, we have vacancy, applyan mo to. Basta ako na nag-no. Sabi ko, no.
Pang digital
parang
nurse
hindi
na
ko
to,
kaya.
In demand ka.
Hindi ko kaya,
Pero diba, like, I think, basta heart failure nurse ka, medyo ECG.
Lahat, as in,
Mahirap
mahirap
din.
din siya.
Reading. Mahirap din.
Oo, kasi yung mga, oh my God, AFib.
Atrial flutter.
Lahat. Ventricular, gano'n.
NCLEX question.
Tapos digoxin, mga
Digoxin,
bisoprolol.
Digivine.
Mga ganyan.
Lahat.
Pero kasi, pag band 6 ka na kasi bro, if you're looking for career opportunity, being a CNS is one of the options.
Oo.
Pero actually may mga band 6 na clinical nurse specialist.
Meron.
din.
Depende ata yun sa Depende sa trust ba
Yeah,
yun?
tsaka meron din mga training, yung mga trainee na.
Yeah, so mga second
Maraming meron din research nurse,
Oo.
band 6.
Magaling.
Sa amin sa department yung mga CNS, kasi sa gastro ako eh.
Oo.
So mga liver, sa
IBD.
IBD, yun.
Maraming IBD CNSs.
Napaisip na ako dati. No, pero
As in,
nakita ko naman kasi yung trabaho nila. Di ko.
Ang hirap. Pero, yun yung mga, sabi mo, salute to bedside. Mga ano din, mga...
Salute din naman sa
salute
mga...
actually, lahat.
Lahat
pero,
naman.
may mga for me lahat ng nurses super hirap ng trabaho. Pero may mga nurses na, that specific area na, parang they deserve more. Like, kasi, ang hirap. Like, bedside nurses. Mga IBD, mga ED.
Believe din ako.
Grabe. As in, they deserve
ED.
really...
Ward.
Yeah.
A&E.
Yun nga, bedside lang. Grabe ang hirap. Ako, sa lahat ng di ko na kaya mag-bedside, promise. As in.
Yung likod ko, I think, after the moving in.
Parang they deserve like times 2.
Di ko na so, nung nasa A&E ako, di ko na alam kung unahin ko, kung iihiba ako, iinom ako.
Or kakain ka kasi gutom ka na.
Tapos, yung break kasi namin, ang ganda din sa ED namin, bro. Meron kaming tannoy. Ano yung tannoy? Yung sa majors namin, yung parang sa mall, yung paging, sage manto. So, pag nag-break ka, for example, night shift, natulog ka, page ka doon. Paging, sage manto, you need to come back to majors.
Tulog ka?
So, ikaw, kahit tulog-tulog ka, gigising ka.
Oh my gosh.
Ganun.
Ward 1 ako before.
Wait lang, Ward 1 is labor, OB.
OB.
Memorize ko pa ng soto na.
May din kami doon, like
Meron
announcement. Pero hindi siya para sa nurse.
Hindi.
Discharge and admission siya for the
Bro, grabe
patient.
yung ward nila, bro. Ward 1. Nakita ko ng...
OB yan? OB ward ba yan?
Bro, isang bed, 3 pasyente. 6 pala kasi may baby.
Ganang OB ward. Ang OB ward sa regional
Grabe.
hospital. Tabi-tabi sa isang bed, 6. Diba? Tapos amoy...
Yung magsumo, naka-ano ka.
Lokya, tapos meron pa
yung magsumo, magnesium sulfate
tama.
mo. My God, may isa kang parang cart na...
Oh my God, tapos amoy lokya, tapos may naka...
Tapos
may
bilib ako.
naka-
Ano kung ba't bilib ako sa mga nurse sa OB?
transfusion.
3 lang ang duty nun.
May admission.
100
Yes.
patients, di ba? Pero na-handle nila yun.
Oh my God.
Kaya nga, pag nag-abroad sila, wala to. Ano ba to
Para
sa...
ako nasiraan ng ulo dun last. Yun yung last ko
Ward
na
1 ka pala.
Ward 1. Pero, grabe.
Alam
Alam ko na yung trend sa Pilipinas. Pag
alam ko
October, tataas na yun.
So yung
census
yung mga ginawa kasi yung
ginawa sa lamig season.
mga ginawa ng December, lalabas na ng September, October.
Diyos ko.
Ang chart nun, kampal ng chart, no?
Oh my God, still chart pa tayo.
Oo.
Ay, those were the days.
Anyway, bro, we're halfway the episode, pero Shelly, what is your advice sa mga, let's say, bedside nurses or mga nurses na gusto mag-clinical nurse specialist? Paano sila mag-start?
Para sa akin, if may interest ka, like, if you have to listen to that voice, inner voice. Oo, kasi if you're interested in something in nursing, and you're really champion for it, kahit ward-based ka, bedside, and then you're like interested, let's say, catheterization, magaling ka sa urinary catheterization, ikaw yung champion sa ward mo nun. Grow on that, and then really develop that skill, go for courses na mga free, ang dami niyan. And then, if there's an opportunity na mag-pop na band 6 ba ngayon na ward CNS for urinary or incontinence, grab it. Kasi this is the thing. If you don't ask, you don't get.
Tama.
Yes, exactly.
So, for us, and this is why I think I'm very proud you guys are doing this as well. I have to say, because Filipinos, they always say, oh my gosh, Filipino nurses, the best. All over the world, export-wise and blah, blah, blah. But we don't get to be really, we have that imposter syndrome in us.
Yes,
and
exactly.
We don't get to really own up that we're good.
Yeah.
You can, yes, have that voice of still doubt yourself. But if you believe you're good enough and you really want that job, go for it. Because if you don't, you'll be band 5 for long. And you don't blame it to others. Just reflect it on yourself. Like, if you want this job and you want to really go for career growth, progression, and all that, go for it. Because if no one will do it for you, it has to be yourself.
Grabe yung answer.
Very well said. Bro, pang beauty pageant
Congratulations,
talaga.
Miss Cebu. Ito, very well said.
Pero may background pala, nagbe-beauty contest talaga to si Shell.
Diba?
kaya
Miss
Oh
ano
my
ka
God,
nga? Miss ano yung salihan mo?
Ano tayo? Miss Mandaue. Pero ang tagal na nun. Just my God.
Hindi, pero the way you answered the question, alam ko na
may
something
may coaching.
With conviction.
kasi yung asawa ko, nagpa-pageant din.
Oh,
Pag
yeah.
nag-aaway kami, sinasagot ang mga ganyan eh.
Yes, dapat.
Yung mga pang-pageant na
na
sagot.
parang wala ka talagang closing statement na.
Kaya tumatahimik nila ako. Oh.
Always right. Wives are
Oo.
always right, diba?
Pero
Happy
you're-
wife, happy life.
Yes, correct. Pero you're correct. Ang galing ng paka-explain mo dun sa...
Oh, thank
Ano
you.
sabi mo parang you will not ano sabi mo yung parang if
You don't ask, you
if
don't get.
Yeah.
So,
If you didn't try,
Yeah, wala.
dadating yung panahon,
actually
di ba?
parang same add ko din, you won't know unless you try.
Tama.
Di ba kasi
True.
sabi na, mahirap ba yung ano? Kasi iba kasi it may be mahirap to me
Oo.
but not to you. So
Tama.
wala ang best talaga gawin i-try mo.
Yes.
If
I think.
mahirap, if hindi mo kaya, at least try mo.
Oh, yes,
diba?
that's it. Like I think we're always scared,
Scared.
for the no answer
yeah.
or okay, no. But
Yeah.
I think there's nothing wrong with
Yeah,
no.
you never know.
Ako, may theory ako dyan kasi tayo ha, opinion ko lang to. That's why we're afraid to try kasi Filipinos kasi may pagka-perfectionist as a nurse. Feel ko lang. Kasi we are afraid to fail on
Fail.
something
Yeah.
and sabihin na, ay, di ba Pinoy ka? Bakit di mo to kaya? Yung mga ganun ba? Yun yung reason na bakit ayaw nila mag-try. Parang ganun.
Yeah. Grabe din naman yung yung ano natin pinagdaanan
Training
sa
grounds.
training grounds in the Philippines.
Oo.
Yung perfectionist natin ng mga nursing lead. Yung nursing, tawag natin sila,
Clinical instructor?
hindi,
Sa ba?
yung mga parang matron ba? Sa
Yung
mga supervisor.
Supervisor.
Oh my God.
Chief nurse o mga
takot na takot ako dun.
Takot
sa
ka ba?
kanila.
head nurse, ganun.
Oo. Kaya nga pag napunta tayong abroad, yung sabi na baka mabuli, di ba? Pag bago ka, parang sa lahat ba ng
Dinaan.
pinagdaanan ko sa Pilipinas,
Dinaanan na
bubuli.
namin.
Marunong na tayo mag-handle ng mga ganyang situation, di ba?
Yeah.
Kahit saan ang Pilipino, kahit saan country mo isabak, Middle East or Europe, alam nila yan kung paano.
Totoo.
Sumabay.
Also US. Oo.
US, of course. Yeah.
Definitely.
Sabi niya bro,
Happy wife?
Happy wife, happy life.
Oh. Let's talk, ano muna tayo sa nursing. Kasi
Yes.
na-mention niya happy wife eh. So, how is your relationship with your family, with your husband, with your baby ngayon?
We're definitely in the hands together kasi very young pa yung baby ko. It's
Oh.
18 months.
Diba? And you're full-time.
I'm full-time, my
Your
husband's
husband's
full-time. So,
Di ba? Ang hirap nun, di ba? Kasi mostly nagpa-part-time ang isa. Oo.
wala. Full-time kasi, my God, ang mahal ng bilihin.
Yeah.
Oo.
Shout out to the economy.
Yeah.
Oh my God, hindi ko expect.
Kasi ang ano kasi
Promise.
dyan, ang challenge is, kailangan nyo mag-part-time to take care of the baby. But, mga ano naman yung siyempre, you need to pay bills.
Oo, so yung sweldo niya.
Oh, yun naman
As in,
suffer.
wala talagang
balance.
I think there's no perfect formula in how to especially in a young family.
Kaya bilib ako sa mga young family dito sa UK talaga.
Oh my gosh, yung nanay ko 6 months lang, kinukumbinsi ko pa, ma, please,
Oh,
balik
diba?
ka.
Isa yun sa mga...
Nananawagan
po ako.
Nawawagan po ako sa nanay ko.
Isa yun sa mga way, pinapapunta yung mga mom,
yung
yung
mom,
mga in-laws,
Yeah.
di ba?
But my mother-in-law is here. She's very helpful. So, every Thursdays, nasa kanya yung little one, baby ko.
Pero the good thing is you're not doing night shift.
No.
Diba? And your husband is
9
not
to 5 ka, di ba?
9 to 5 ako, but my husband does night shift.
kailangan may isa na nag-night shift talaga.
Talaga. Kasi hindi kaya.
Siya yung sacrifice.
May siya, may funny story siya about her husband.
Okay, bro.
OMG.
Kwento mo.
Dito kami nag-meet. So,
Dito kaya, akala ko Pilipino yung husband mo.
hindi. Charot.
Teka lang. Pwede mahulaan yan.
Walaan mo, feel ko.
So, di yan Pilipino, syempre.
Oo. So, kami, nag-meet.
Anong hula mo?
Teka lang. Saan kayo nag-meet muna?
Siyempre.
Okay lang, sabihin.
Sige, go.
Sige, saan kayo nag-meet?
Dating app.
Nice. Nag-ano.
Success story.
Congratulations po sa mga ating kababayan na sumakses sa dating app.
Wag po natin yung...
Tandaan po natin, itaas ang bandera ng Pilipinas. Yan.
Pero,
Yes, congrats.
Oh my
Joke
God.
lang
Ano ba?
yun,
Ay, joke lang po yun.
Pwede
Pero, believe ako sa mga...
Yeah.
Pero, di masama.
Ang ganda mo, tingnan mo naman si Shelly.
Oh, yan po ang evidence na hindi lahat sabihin na sa dating app failure. May mga success stories.
Baka naman, hinge.
Tsaka, hindi rin sabi nila, di ba, parang naghanap ng AFAM or mga
Hindi.
Breton para yumaman. Pero tingnan mo sila Shelly,
Kayod
di ba? Kung mayaman talaga yung habol niya, yung ano niya, naghanap siya ng mayaman talaga, hindi siya magproblema ng ganyan, di ba?
Oo. Hindi
Grabe.
naman lahat na nag-dating app, naghahanap ng mayaman.
Totoo.
Diba?
Yeah. So, I
Siyempre,
think
ma-feel mo pa nag-click kayo, Yun important.
And I think the blessing of that as well, kasi kami, pa-COVID noon. So wala masyadong, pa-lockdown na. So yung mga date namin is Richmond Park, Battersea Park,
Kasi pwede
syempre.
maglakad-lakad sa park that time.
long
Ang galing.
walk.
Yung pandemic time, yung dating app active eh. 'Di ba?
Yun yung parang peak ng
Oo,
mga...
peak ng dating app.
Ano ka ba? Nag-dating app ka ba?
Hindi. Nakwento lang sa akin. Nakwento
Wait,
lang.
tapusin mo na kwento mo sa
Yeah, sige.
Yeah, so yun, nag-meet kami sa Hinge. Baka naman, success story.
Success stories. Teka lang, ano ba siya? British siya?
Oo, British.
British.
And then, very different industry. He works for Heathrow Airport in engineering. So,
Baka
different.
naman may free ticket.
Baka
Airport
naman.
nga, di ba? Hindi mo
Pero
airline.
very different. I think that's one of the things as well na bakit kami may napag-usapan kami na outside nursing.
Kasi kung puro nursing, no?
Oo.
So,
Pero pag ikaw, pag after mo nag-uwi ng bahay, stress na stress ka, do you talk to your husband na, ang kapagod sa work ko, gano'n? Or do you,
I tell him as
nakinig
well.
naman siya?
Siya din naman, he tells me also.
okay,
Kinig lang din ako. Like, talaga?
Kumusta naman yung adjustment?
Ng my baby.
Hindi. British yung ano mo.
Pag galit na ako, hindi ako
Mag-English na straight.
Hindi mo ma-express.
Hindi na.
Paano magalit?
Quiet na lang.
Quiet na lang.
Kasi mag-English na.
Hindi ka Bisaya.
Magbibisaya ako pero wala na. Nag-give up na din
Nag-give
yung
up na din.
Bisaya ko. Kasi before, nagbibisaya ako sa kanya. Wala siyang...
Kasi di
Hindi
maintindihan.
maintindihan, di ba?
So, sabi
Parang kasi
niya,
mag-away tayo.
Quiet na
Tahimik
lang. Pero alam na niya ngayon, pag quiet na lang ako, sabi, why are you being stroppy?
Stroppy?
Ano yun?
Parang stroppy ha?
So yun. Yun
Hindi
yung
sila nagluto.
Ako pa rin.
Ikaw pa din.
Pero siya, he does, if he's with our baby, tapos work ako full-time kasi Monday to Friday. Siya yung Pero air fryer is key.
Yeah.
Okay.
So,
Thank
air
you.
fryer
Ano,
lahat.
Ninja?
Ninja.
Ninja.
So, oo.
Okay.
So, siya? Nakapunta siyang Pilipinas?
Oo, nakapunta na siya. Love na love niya. Feel
Love
na
niya.
feel.
Filipino food,
siya?
gusto niya.
Oo.
Okay.
Siya dun? King of the... gusto niya dun na to.
Gusto niya.
Doon na lang kayo gumawa lang kayong hospital.
Oh my God. Ako dun.
Yeah.
Pero yeah. Masaya naman. Pero yun, yung challenging nga namin ngayon is the little one. Childcare is difficult. Pero we're managing well. All smiles pa rin.
Yeah. And she looks very blooming.
Oo
Kapag-
naman.
Hindi naman yung
Blooming.
losyang, di ba? Very blooming. So,
Dapat kahit
Thank
busy
you.
sa work and
And sa
family.
family.
May
Blooming pa
funny
rin.
story ako. Yung dito ng nanay ko, after ako nanganak, tapos maternity leave ko pa. Wala akong pake. As in, wala na akong pake kasi bata. Oh my God, breastfeed and all that. Yung nanay ko talaga, bigay mo na sa akin yung apo ko. Magkilay and lipstick ka. Sabi ko, bakit? Nasa bahay lang tayo.
meron kasi sa bungot siguro.
Kailangan mo.
Napansin na siguro ng nanay mo. Parang iba na itong anak ko
Parang meron na siyang bungot eh.
Kailangan mo ng
Natakot yung nanay mo. Baka,
natakot yung nanay ko mismo. Pero yun. I think, kailangan, you have to look after yourself pa rin.
Tama.
Ayun. Anyway, Shell, parang medyo nag-enjoy tayo sa usapan.
Oo.
Parang, lampas na tayo sa
OMG, sorry.
Nag-enjoy ka?
Sobrang
Anyway,
ka.
ang last question ko na lang sa'yo is, ito na yung tissue part.
Sige.
If meron kang masasabi sa younger self mo, ano yun at bakit?
I think if I was to talk to myself, younger self, never doubt yourself. The fact na you're here right now and, eto na yung achieve mo. Kasi before, I think insecurities can really drive yourself mad and question your abilities. But never let that doubt cloud over you. Go lang ng go.
Yes.
Charot. I think that's what I will say to myself. And I think that's what I'm gonna tell my daughter as well.
Oh.
Dapat lang. Kasi you have to believe in what you're capable of.
Yan.
Charot.
Thank you,
Another
Shell.
closing statement.
Thank you.
Grabe na, Jud.
Support Nurse Show.
Yes.
Yay!
Thank you. Go, bro.
Masabi ko lang is, yung sa career progression, tama yung sinabi ni Shell. If you want to succeed sa career nyo, better try.
Yeah.
Kasi di mo malalaman hanggat wala ka dun sa situation na yun.
Totoo.
Yeah. Yun lang. And bro, ikaw?
Ang sabihin ko lang is yun sana dapat sabihin ko pero dapat ako na lang pala nauna. Hindi, yung sabihin ko is thank you Shelly and thank you everyone na this episode is parang reflection din ba na ang mga nurses magaling talaga. It's just a matter of looking for saan mo mas
saan ka
ano ba yun?
saan ka ma-appreciate?
Saan ka ma-appreciate at saan
ka
parang
swak.
you want to give your best ba yung parang pero dapat naman talaga everywhere ibigay mo best. Pero iba pa din yung parang kung gusto mo yung kung nasan ka. Yan.
Yun.
Ayun lang naman, guys. And please don't forget to follow me, Siege Manto.
Yes.
Facebook.
Follow me as well, EJ Abarientos and EJ Creative Studios.
Yes. Before tayo mag-finish, may gift kami para sa iyo
Simple token.
Simple token lang kasi wala pa kami budget pero I hope you will like our. Actually, hawak mo na. Yan, meron kang official merch ng official merch ng The Nurse Nurse
ginamit ko
Show.
na.
Yeah.
That's limited edition.
Only 10 in the
10
world.
lang yan. From Switzerland pa yan.
Yes.
Pinagawa. From the mountains of Switzerland.
Yeah. So ito yung sa'yo. I hope you like it. And
Thank
I hope you
you.
use your pag sa work mo or sa bahay mo. Malala mo kami at malala mo yung mga charla.
Gagamitin ko to sa nurse-led clinic.
Yes.
Tapos sabihin ng pasyente, ano yan?
Picturean mo story mo. Tag mo na lang kami.
Thank you guys.
You're welcome.
Thank you so much.
So,
Thank you.
thank you everyone again. This is Siege Manto, your digital nurse from London.
And EJ, your nurse photographer.
And this is the
Nurse
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 Show! Thank you!
Thank you.
Bye-bye!
Hi, it's Shelly, your clinical nurse specialist. If you want more interesting nursing stories, please follow The Nurse Nurse Show.
Nagustuhan niyo ba yung episode natin ngayon? Don't forget to hit that subscribe button and click the notification bell para updated kayo sa chismis.
This is your safe space, mga ka-nurse squad. We feel you, we hear you, and we are you. This is The Nurse Nurse Show. Dito ka belong.